Hi BYS, my name is Phil Forsythe. I'm a doctor of physical therapy with the Jackson Clinics and I'm a sports-focused clinician. Today we're going over some of the most common soccer-related injuries and how we can help you determine whether or not you should see a doctor, a physical therapist, or whether or not you and your parents can manage this on your own. Today we're talking about the quads, and we've got our great model Ben here, and he's going to help us through the model. So, quad injuries are one of the most common injuries that soccer players are going to experience. A lot of it revolves around either your kicking leg or your stance leg and how you might injure those. Today we're going to go over when and where you should be able to identify what kind of injury you have, how severe is it, and whether or not you need to go see a healthcare professional or you can manage it yourself. Then we're going to go down to the ground here next. Now when we talk about the quad strain, typically it is the two-joint version of the quad. So we have 4 quad muscles. One of them is both a hip flexor and the other is the primary job of the knee extensor. So when we talk about quad strains, we're typically hitting that two-joint muscle primarily, but you could also strain the other 3 as well. Now, when we look at the quad, we're looking at a couple different things. It's the front muscle on your leg here, and we're looking for bruising. Number 1, how severe is this injury? Is there a lot of bruising that's going through the front of the quad? Can you feel any kind of divots in the quad as you work your way through it? Those are clear signs that you've done some damage to it. Now we ought to assess a couple things. We're going to test its flexibility, its length, palpation, see how it feels in there, and then we're also going to contract that muscle. These are all very easy ways for you to test at home and see whether or not you're dealing with a grade 1, grade 2, or grade 3 injury, and we'll talk about how we should identify where to go for each of those different grade of injuries. All right, Ben, so let's have you lie on your back here for me, and we're going to start with palpation first. We're going to see how does this muscle feel. So our quad starts up here on a bony prominence in your hip, just below that. We're going to dig deep in there and we're going to see how he feels. Now you can have 2 common injury sites for most strains. You can have it in what we call the mid-substance of the muscle, through the muscle belly itself, or you can also have an injury to the tendinous insertions or tendinous origins. So we're going to start here, we're going to dig deep in, and we're going to poke and prod a little bit. Now Ben, you're always looking out for things like wincing. You're looking out for pain. A lot of the times a person will just tell you, yeah, that hurts a lot. You're going to work your way down the mid-substance of the quad first. Ideally, you want as much skin as possible so you can see as well as you're touching. And then you're going to look for bruising, swelling, divots in the skin, any particular points where there's a lot of pain for him. Now, the unique thing about the quads is that they have different origins, but they all insert into a common tendon called your quadriceps tendon. So they all converge right above the kneecap here, and that's where you're really looking to see is there any pain there. Then you're going to go through the kneecap itself because you carry that mechanism down to your lower leg here through the patellar tendon. And you want to make sure both of those tendons are also adequately cleared as well. You can also come in to the inside here. You're going to be working more of the inside quadriceps muscle all the way down to that common tendon. And you can also work the outside. Make sure you don't go too far and you hit a really thick piece of tissue over there. That's your IT band. That's not what we're looking at for today. Coming down across the inside. And that's where Ben has the majority of his pain, is on that outside portion. So we're thinking he might have a strain of his vastus lateralis. Good, coming in there. All right, so we've done our palpation. Next up, we got to start to either identify the load on the tissue. So we're going to start with some passive stretching first. Now what I'm going to have Ben do is I'm going to have him flip around onto his stomach, and we're going to take a look at this. So when you're stretching the quad muscle, you would ideally want to get him into a little bit more hip extension, but this position is just fine for today. So what we're going to do is we're going to slowly bring the leg back. Ben is going to let us know when he starts to feel either an intense stretch or his pain. And right there. So that's a little less than we'd like to see for your quad length. Ideally, we'd like to get your leg down to your butt on the other side. And that can really show you the difference between an injury is how far can they go before they start to get their pain. Next up, we're looking for the quality. What does he feel? Does it feel like an intense stretch? Is it the sharp pain that he felt when he may have injured his quad? Or is there something else in there? Is there numbness or tingling? Those are all things that we're concerned about when we're evaluating these kind of things. All right, next up, we're gonna load this quad up. So let's have you turn around, Ben. There's a couple different ways you can load the quad up. One of the easiest tests is first, see if they can give you a solid quad set. So we're gonna use his healthy side here, and I want you to give me, we're gonna use his uninjured side, I want you to give me a squeeze here, Ben. See how that nice quad set comes in, you get a robust contraction. Now give me a little bit of a weaker one here, and it's not as strong, it's not as robust. That's a defensive mechanism by the body to kind of prevent further injury, but it's something that is a priority to restore as soon as possible because your quad is such an important muscle. Once you establish that he's got a good quad set, you can go into an active straight leg raise next. So, Ben, what I want you to do is I want you to squeeze your quad, and I want you to try and lift your entire leg up as far as you can. If it's painful, let me know. Right there, doesn't get very far. Good, drop that back down. You always want to help them assist if they're getting in pain on the active contraction. So that's telling us that really that rec fem is probably a little bit annoyed, but also that vastus lateralis because it's helping to control the extension. All right, so we've established what we're looking for when we're evaluating our quad. Now let's talk about the specifics of our grading system. So we have grade 1. These are low-level injuries. These are very common injuries, and they don't need a ton of extensive care. You just gotta be smart about it. So with a grade 1 injury, what you're looking for is very minimal bruising, if at all, and they might be a little bit painful to stretching and to contraction, but it's still able to walk around. They're generally still able to do some of their sport-specific maneuvers. They just feel a little bit off or it's a little bit painful. These are the kind of injuries that most people should be able to take care of themselves. And we're gonna cover that in our next video of how to actually manage this issue on a grade 1 strain. Now, when we talk grade 2 and 3, those are our more intense injuries. These typically come with a lot more bruising, a lot more swelling. You might feel the divot in your quad. These are the ones that we're more concerned about and want you to see someone about. Now that we've identified these injuries and we know who to go see, it's important to note that physical therapists in Virginia can actually see our patients direct access, which means we don't necessarily need a doctor's referral or script in order to treat you. We are very much trained to identify when these injuries are exceeding our capacity, and we need to bring in physicians into the equation. It's important to note that you do want to see someone who has a lot of experience with sports-related injuries. We here at the Jackson Clinics are part of the sports residency, and we're committed to working with our athletes, and there are also multiple other providers in the area who do the same.